All the slides used here belongs to their respective owner. I or the channel does not claim any rights over them. This channel is only for educational purpose. Hi everyone, I am Shahan and today in this video I will tell you about Apert syndrome. Now what is Apert syndrome? Basically, Apert syndrome is a kind of syndactyly. What is syndactyly? You can see that the fingers in the lefts or in the picture you can see the fingers are joined. That is known as syndactyly. Basically, Apert syndrome was first discovered by a French physician. His name was Eugène Apert, and that is from his name Apert syndrome came. It was discovered in 1906. 1906, it was first described by French physician Eugène Apert. Basically, Eugène Apert studied 9 different people, and these 9 different people has a condition known as acrocephalosyndactyly. What is the meaning of the term acrocephalosyndactyly? From the name itself, we can understand acrocephaly. Acro means tall. Cephaly means brain. So the brain or the head is tall. That is known as acrocephaly. And syndactyly. What is the meaning of the term syndactyly? Syn means together, united, and dactyly means fingers. So the fingers are joined together. So that is known as acrocephalosyndactyly. So this is Apert syndrome. Basically, acrocephalosyndactyly is a condition when the bones or the skin of the fingers and toes are joined together. They are seamed together. So that is known as Apert syndrome. We will learn in details in this video. Now you look at this picture. You can see the baby. He is having the Apert syndrome. You can see the head of the patient. The head is tall. The head is pointed. That is known as acrocephaly. Acro means tall, pointed head. Cephaly means head. So acrocephaly, tall, pointed head. Next, another thing is the patient have cleft palate. Very important, cleft palate. Can you see cleft palate? Another thing is high forehead. The forehead is very high. The forehead is high. Next is bulging downward slanting eyes. So when you look at the eyes, these eyes are bulging out and they are slanting downwards. So downward slanting eyes. Always remember, bulging downward slanting eyes. Other important features are flat or beaked nose. You can see either flat or beaked nose is there. Another important thing is open joints or sutures. So there is a room for the brain growth, and that is very important. So in case of infant skull, if you observe the sutures of the skull, the sutures are opened. So the joints between the skull bones are opened. So that is why, so that the brain can grow. That is known as acrocephaly. I told you, tall, pointed head. Another thing is very important, that is wide thumb and connected fingers. These two things are very important. So the thumb is wide. And what about the fingers? Or you may look at the toes. The fingers and the toes are connected. So syndactyly, very important feature. Syndactyly, joined fingers and toes. So all these are very important. Whenever they say acrocephaly, syndactyly, all these are features of Apert syndrome. Now let us learn what is the cause of Apert syndrome. You can see in the slide. Basically, Apert syndrome is caused due to a mutation in the chromosome number 10. So always remember, in which chromosome? Chromosome number 10. There is a mutation. What happens? Which control the production of a protein known as fibroblast growth factor receptor 2. So this is the name, FGFR2. You can remember FGFR2. FGFR2 protein controls the bone and the skin formation. So what is the function of this FGFR2 protein? FGFR2 protein controls the formation of bone and skin. So when there is a mutation in chromosome number 10, then the gene is affected, and because the gene is affected, the FGFR2 protein is affected, and this protein is basically responsible for the bone and the skin production. Always remember this thing. Another important thing is this syndrome is usually found in children of elderly father. So if a children is born from an elderly father, then you can get this syndrome basically around the age of 50. So when the father is around the age of 50, if he has produced a baby, and that baby can have a syndrome known as Apert syndrome. When it is not inherited, the mutation happens in the sperm. This is very, very important. The mutation happens in the sperm. Now in this slide I will tell you the inheritance of Apert syndrome. You can look at this picture. Apert syndrome is basically inherited in autosomal dominant pattern, and you can look at the pedigree. Every generation is having the syndrome, so it is a dominant disease. Every generation is having the disease, and it is autosomal, it is not sex linked, so you can understand this thing. This type of inheritance is shown on the right side. You can see how this is transferred. Basically, if one of the parent is having the disease and other one is normal, then there is 50% chance of the progeny to have the Apert syndrome. Now look at this picture. This is an original picture. You can see how Apert syndrome affects the fingers and toes of the patient, and you can see it is known as syndactyly, joining together of the bones of the fingers and toes. That is known as syndactyly. Syn means joining, dactyly means the digits. Look at this. This is another example of syndactyly in Apert syndrome. What are the symptoms and signs of Apert syndrome? You can look at this picture. Broad skull. So the skull will be broad, basically tall head. I told you acrocephaly. Another important thing is cleft palate. Cleft palate is very, very important. And another one is syndactyly. So basically, if they give you a case where these three things are present, acrocephaly or broad skull, cleft palate and syndactyly, then you can understand this is actually indicating the Apert syndrome. This is another picture of Apert syndrome patient. You can see the head is tall and pointed, and if you see the nose, it is blunt, and also you can see the slanting, downward slanting eyes. And there is also defect, but this patient is not having the cleft palate, but you can understand all these features are indicating that this patient is having Apert syndrome. This is a diagram where you can beautifully understand how the disease is transmitted from the parent to the children. You can see the father is affected and the mother is unaffected. So affected father and unaffected mother, then there is 50% chance of having affected child. I told you, see the left side, affected child, then unaffected child, then unaffected child, and then affected child on the right side. So there is 50% chance. 2 out of 4 children are having this disease when his father is affected and mother is unaffected. So always remember, autosomal dominant condition, it is Apert syndrome, and it is inherited in such a fashion that if father is affected or one of the parent is affected and another parent is unaffected, then the 50% chance is there that the children will be affected. This is another picture you can see of Apert syndrome. Why I am showing you so many pictures is because if you look at these pictures, you can remember the disease well, because these are actual patients of Apert syndrome. You can see the face of the baby. It is tall, pointed. You can see the first picture on the left side, then on the right side, when laterally you can see how it is pointed, because the sutures are not closed properly, so there is a room for the brain to grow more. So you can see all these are showing acrocephaly. Acrocephaly, that means tall head. This is a feature of the Apert syndrome. Another thing, you can see the look at the eyes, downward slanting eyes, very very important, downward slanting eyes. So this is also a very very important feature of the Apert syndrome. This is another picture where you can see this is showing the syndactyly. So basically, what is the treatment of Apert syndrome? Basically, the treatment is surgical treatment. Always remember, surgery is done to basically the surgeon tries to separate the fingers and toes, so that is corrected surgically. So this is the end of this video. If you like this video, make a thumbs up and please subscribe this channel.